Hello, I'm Dr. Melita Tate. I'm at Grassroots Healthcare. We're located on 91st and Sheridan. I'm talking to you today about health and wellness. We have a clinic here. We've been here for 3 years. We see mainly patients who don't have insurance or who have high deductible insurance. We started this clinic based on the fact that we wanted to care for patients without government or the influence of government or insurance involvement. So we started the clinic about 3 years ago. We've had quite a few patients. It's been very rewarding for me as the physician to have patients come in and go from a setting where patients were waiting for quite a long time just to see me in the urgent care, and they would be frustrated because they had their own doctors, but their doctors couldn't get them in to be seen, so they'd be waiting for quite some time to see me, to coming over here where we could see patients in a more timely fashion, and we didn't have to worry about filling out paperwork for insurance, that kind of thing, and take our time with the patients and not push insurance dollars around. And a lot of times when we'd see the patients, even before we got to meet, or right as soon as I'd walk in the door, they'd be like, "We're so glad we found you," because our office visits are much less. And I think the main thing, our office visits run around $49 for just a simple sick visit, and then of course, depending on how complicated the visit is or what kind of labs you need, our labs are deeply discounted. But I think the main thing that patients appreciate here is that when you come in, most of our prices are listed right out front, so it takes a lot of the stress out of the equation, and patients can kind of see fairly quickly, or at least come up with a rough estimate about how much things are going to cost, which is nearly impossible in today's medical community. And that takes a lot of stress off the patients. And we're pretty easy to talk to, and it's easy for us to sit down with the patient and discuss options and kind of how we can work things up with the patient in a way that they won't feel so threatened or feel so worried about, how much things are going to cost and which things are more important to do right off the bat. So we've really come along rather quickly here with our clinic, and we see quite a few patients. We have Hispanic speaking staff too, so we see quite a few Spanish speaking patients, which I love dearly, the Spanish patients. So, but as we began to grow and as we began to see more and more patients come in, we have a pharmacy here in town called Scripts, and we have lots of pharmacies here in town that we're very good friends with. One of our favorite compounding pharmacies is Economy Pharmacy too. But Scripts has been wonderful for our patients because they mainly just deal in generic prescriptions. They also don't take any insurance, and so it's easy for the patients to go in there who don't have insurance, and they don't have to worry about waiting while insurance is being run for a bunch of other people, and they can just kind of watch and see. They can kind of get in there and see how much their prescription's going to be real quick, get their prescription filled, and they're out the door. A lot of the generic prescriptions at Scripts, I can tell the patients before they leave here, are going to be $10 for 100 pills, which is a lot of times 3 months supply for blood pressure medications, and so we can save the patients quite a bit of money over some of the more higher priced pharmacies here in town. That gouge up on the prices, and we can show them quite a price difference and make a big difference just in how much money they save on a month-to-month basis just in their prescriptions. So all that being said, it takes a lot of stress off patients. But as we began to do this business, we started to see more and more patients who were interested in their health and their wellness, and wanted to find ways to treat things that were coming up in their lives. We really see a lot of anxiety in our patients, a lot of insomnia, a lot of nervousness, depression, things like this. And if you ask any primary care doctor across the United States, they're going to say that they're seeing a lot of those kind of conditions, and we're not quite sure why. The other thing that we're seeing are a lot of autoimmune disorders, thyroid conditions, so hormone disorders, thyroid, and also we're seeing a lot of like polycystic ovary disease. We're seeing a lot of metabolic syndrome where our patients are unable to lose weight, gaining a lot of weight, having a lot of insulin resistance, which is leading to diabetes. So there's a lot of conditions like that that we see in the clinic. And as we began to evolve as a clinic, initially we just started this to see patients without insurance, but we've evolved more towards a health and wellness perspective, and we're starting to see patients who are interested in trying to stay healthy and monitor their own health rather than waiting for a disease process to crop up and take a medication for that. So it's been quite a challenge for me to keep learning new things with my patients as we've gone through with the clinic. And one of the things I wanted to talk about a little bit today was the pH of our bodies, some different ways that we can monitor how healthy our bodies are, simple ways that we can do that, and how we can monitor what we're eating and how it's affecting or changing our bodies, and what we can learn from that about our system and how we can make changes to better our health. So I learned much of this from one of my dearest groups that I'm involved with, is the Mortar Institute. Dr. M.T. Mortar has put together a phenomenal program called Bioenergetic Synchronization Technique, which I'll talk to you guys more about maybe next week or another a show. But he also studied a great deal about the pH of the body. Now, many of you guys may or may not know, but the pH of the bloodstream is going to stay constant. Our body is not going to change the pH in our bloodstream. Our bodies are very, very smart, and we put different things into our bodies every day. And most of the things that with our culture that we put into our bodies are especially the proteins of the poultry, the meat, some of the grains, especially some of the processed grains that we're eating. Those things cause an acid to be produced in our bodies, at least kind of an acid ash residue in our bodies. When we digest those things and burn up the fuel, that's what's left. That has to be eliminated from our bodies. Our bodies in our bloodstream have a pH of around the 7.35 to the 7.45. pH basically stands for the potential of hydrogen. There it goes anywhere from 1 to 14. pH of 1 is extremely acidic, and a pH of 14 is extremely basic. We want more of a neutral pH that's more conducive to life. But there are places in our body where things need to be more alkaline and things need to be more acidic. For instance, and for example, would be the stomach acid. In order to help digest our foods, we need to be able to produce a condition in the stomach of extreme acidity. And so the stomach acid can sometimes be as acidic as a pH of 1. So what we eat, our body takes that and has to neutralize it. And so there's different ways throughout our body and through our system that we neutralize the acid. Our body's not going to allow that acid to get to our kidneys in an acidic state, because that would be harmful to our kidneys. So what our body does is use minerals in our body, which they're there for that purpose, to tag on to the acidic foods that we eat and neutralize the acidity. What happens is we lose those minerals in our urine, along with the acid byproducts of the food we eat, in order to make our urine more neutral and to protect our kidneys, so that we're not peeing an acidic urine all the time. So what I want to introduce to you today is a way that we can understand how our bodies are faring by looking at how our pH of our urine, or how the pH of our saliva responds to a challenge of acid or base meals, and then also how we can change our diet. And it's been studied, and there have been quite a few studies shown now, and if you talk to any dietitians who work in cancer treatment centers or some of the other well-known cancer centers in this area or across the United States, they'll explain to you that keeping your body on more healthy foods, whole grains and fruits and vegetables, and things that are going to produce a more alkaline state in your body is healthier for you and decreases your risk of cancers. So this is a way to tell what your body's doing with what you're eating, and how healthy you are, and if you're looking towards getting more into a disease state. A lot of disease states exist because our bodies are having to deal with the foods and different things that we're eating that are more acidic. So for instance, if you take some acidic foods, and I have Dr. Mortar's book I'm going to put up here and see if you can see it. It'll be backwards, I guess, on your screen, but there's more acidic foods in here that you can eat, and I'll try to have a list put up on the website for you guys that are interested later on today. But some of the more foods that produce acid are going to be your, like we talked about, your any of your meats or your poultry. Also, some of your, I forgot to mention, some of your nuts and things like that are going to be, if you have too much of those all day long, you're going to produce an acid ash residue, and then your body has to neutralize that with minerals. Now, the way that your body neutralizes that with minerals, we do have a backup store of these minerals. But if you don't replenish those minerals, then eventually your body will begin to rely on other minerals. And those minerals may have a primary job that they're supposed to be doing. But your body will not allow you to have an excess of acid in your bloodstream or to get to your kidneys. It will protect your internal organs at the cost of, say, your bones. So if you have to use calcium to neutralize the acidity that's in your body, then it will, to the detriment of your bones, and so on. And so one of the ways that we can produce, you'd be surprised, some of the things that produce an alkaline state in our body, or more alkaline ash foods, are foods that are considered acidic, such as grapefruit or lemon, lime, those kind of things that are considered acidic. But when the body metabolizes them, they produce a more alkaline ash, and they restore and give minerals back into the body. That is, if they're grown in good soil where there's plenty of trace minerals, and the crops are rotated, and they're not too GMO modified to absorb good minerals, and they have plenty of the they're not filled with pesticides or harmful chemicals, then they will be able to replenish our bodies with the mineral stores that we need. If we're not replenishing our bodies with the foods that we eat and with vitamins and minerals that we can purchase, then our bodies will begin to take it from other places, like I said, from our bones, those kind of things. And eventually, if our body gets into a severe enough state where there aren't any other places it can take it from, it will use ammonia at the kidney site to begin to alkalinize whatever acid is being dumped at the kidneys to keep the urine pH stable. So some of the more alkaline ash foods would be lots of your fruits and vegetables, so grapes, green beans, green peas, even lemons, raspberries, strawberries, all these kind of good for us foods. And it's interesting, again, to note that if, originally those foods were grown in places where a lot of the trace minerals and elements were replenished in the soil because we rotated crops. And so the least frequently that we rotate our crops, and the more we're growing just monocrops in our soil, and just reusing the soil year after year and not giving the soil a break or a rest or replenishing the trace minerals and elements, we're going to see the nutritional level of our bodies deteriorate. It's really important that if you're at all capable, you start thinking about growing your own food at some level, so that you can get some of the trace minerals and elements that you need, and learn something about rotating crops in ways that would replenish the soil with certain kinds of elements and minerals that it may be stripped up from different things that we grow in it. And it's one of the things that we're not paying close enough attention to right now, where it's such a fast frenzy to grow whatever we can as quickly as we can. We did say we'd answer questions live. I was just going to go double check and make sure we didn't have any questions anyone had. There are a few people on here live, and so some people did ask if there were any, how much vegan or vegetarian diet do we suggest? And that's a very good question, and I'm going to get to that as we go through. I think it's not a question you can answer directly. You kind of have to measure it on your own, and that's what I'm going to try to teach about a little bit today. I brought some things with us. Most of us aren't going to eat enough fruits and vegetables to alkalinize our bodies adequately, but you can, and I'll put that list up there later if you want to try to do it that way. What we'd like to see is for you to, if you're not extremely sick, and again, please, if you're in an ill condition, you don't want to go on a protein challenge of your body, but for about 48 hours, in order to see how your body responds chemically, it's good to try a protein challenge and see if your body's still able to alkalinize the urine at that point. We have some test strips here that are available that you can use. They're just basic pH test strips. You can see the different color wheel on the front of these, and you just take off a little piece of the pH strip and urinate on it and give it a few moments, and then as it changes color, you can measure the pH of your urine. So if you've done a protein challenge by eating the foods that are suggested on the, we'll put them up on the website soon, but the more protein and grains and things that produce an acid residue in your body, then after about 2 days you can check your urine, and if your urine pH falls between 5.5 and 5.8, then that's good. Your body is holds its own and is able to alkalinize your urine adequately. It's adding enough minerals to your urine. If your urine is falling higher than that, at the somewhere in between the 6 range and the 6.6 range, that's kind of a warning stage. It may mean that your alkaline reserve is kind of showing some signs of being in danger, or that your body's having to rely on some of the backup minerals to neutralize the acid that you're taking in. And then if your urine pH is running in the 6.8 to 8 range after you've done a protein challenge, that usually means that your body's relying on ammonia, and that's kind of a last warning system before, or warning sign before you start exhibiting kidney damage and other internal organ damage, and that's a sign that we need to make some changes fairly rapidly. Now, after this, after you learn what your body's capable of and where you're at, then is the key to go back and begin to eat your diet and adjust the urine pH, because you want your urine pH to be falling into the more alkaline range. So you want your urine pH to be adjusted with your regular diet by increasing the amount of alkaline foods that you're eating, so that your urine pH is going to be falling in between around. If your alkaline reserve is good and you're eating adequately to cause your alkaline reserve to be good, then you want your urine pH to be able to be falling around the 6 point range, 6.2 or above, and if it's falling, if it falls, anywhere outside of that range, then you're going to want to change your diet and add more of the things that are going to give you the minerals that you need to further alkalinize your urine. Now, some people may argue with this or say that the alkalinization of your body is dangerous, that might cause more kidney problems. We're not talking about changing the alkalinization of your blood or really about the alkalinization of your urine. Your urine staying pretty acidic in these situations, but we don't want is for you to be so alkaline in your urine that there's ammonia present, things like that. So these are ways to tell if you're getting enough of the minerals that you need in the diet you need, in the foods that you're eating. If you're one of those people that doesn't eat enough fruits and vegetables, if you're always on the go, if you're in complete fight or flight response most of the time, like some of us are, there are other ways to alkalinize your body, and one of One of the ways is that you can take baking soda. One of my good friends just swears by it, and he drinks a little baking soda all day long. It tastes terrible. I've tasted his baking soda drink, and let me tell you, it's not my highest recommendation. And you have to be careful about what kind of baking soda you get, because some of them have aluminum and other things in them. I think he recommends the Red Mill baking soda if you can find it. We've torn all over every store in Tulsa looking for the Red Mill baking soda, so it's difficult to find, but it's supposed to be free from aluminum. And you can find probably some baking sodas in some of the more natural food stores in your area, and here in Tulsa be, you know, Aiken's or Whole Foods or some of those. But there's the Mortar Health Systems does put out alkalizing tablets, and I bought some of these for the patients at my clinic. So we're going to be putting some of you, if you're interested in trying to alkalinize your body and see how much it helps your diabetes or some of your other disease processes. A lot of times it can help you eliminate waste, toxins, things like that, to be in a more alkaline state and have more minerals to help get rid of different toxins and things that are in your body. Then if you're interested, we have these here. We're going to be trying some of our patients on them. They run $10 for a bottle, and you can use these in lieu of fruits and vegetables, or if you're not getting fruits and vegetables, you can take them with your meals. They smell like cows to me. I think they smell great, but some people don't like the way they smell. But they're little green tablets that you take, and they have they have the ability to help alkalinize your body. And you take them 3 times a day, or you can adjust their intake based on your pH levels of your urine. Now, one of the other things I wanted to address was, I was going to show you these tablets. One of the other things I wanted to address was the fact that not only does what the foods that we eat affect our metabolism and our acidity and alkalinity, but also the amount of stress that we're under affects it. Many of you guys may not realize, but we stay in mostly a fight or flight response 24/7 these days. We've got cell phones, pagers going off. We don't like to go to sleep. We stay up till way too late. Our sleep cycles are disturbed. All those things are kind of on negative, and they keep us in a fight or flight response all the time. Fight or flight is an adrenaline-produced condition. So when we're in that condition, all of our we're awake, we're alert, we're in the fight mode, we fight off predators. Survival is key right then. We're supposed to have a balance between that and our parasympathetic system. The fight or flight response is driven by our sympathetic system, and those are certain nerves that exit from our spinal cord. But we also have a parasympathetic system that gets extremely neglected, and the parasympathetic is our rest and digest system, and we neglect that shamefully. Our rest and digest system, parasympathetic system, rarely gets used, and a lot of it has to do with why we're not digesting our foods properly. And so one of the things that we've noticed with patients who have say an ankle injury or something wrong with their ankle, many of you guys follow sports, so you know, you'll see your favorite player get a knee or an ankle injury. If we don't send that player to have physical therapy, you know, he'll limp on it while it's injured, but if we don't send him for physical therapy to retrain his brain where his ankle is in space and where, you know, that it's healed, he'll continue to limp on it for 20 years, even after the injury is gone. His body will continue to protect that ankle, and what occurs is he'll have increased weakening of the ligaments on that side and repetitive injury to that ankle because he never retrained his brain to fully use that ankle because he was still protecting it. And after you walk differently for a certain amount of time, 6 weeks or however long it takes, just like wearing a watch, you lose the feeling that the watch is there. Same thing with walking differently to protect that ankle. Your brain just takes over that and puts it into your subconscious, so you just have changed your walk. And what happens with us, if we stay in fight or flight response long enough, especially under extreme stress, our brain pretty much just takes over and puts us there. And so once the stress is gone, we still are producing every chemical that we produced when we were under the stress response, because our subconscious took it over, and we're still producing a fight or flight response. And that's one of the reasons why I think that we see patients who've never had high blood pressure before come into the clinic, and suddenly now they have high blood pressure. We'll see patients who've never had any problems with allergies before suddenly come into the clinic and have allergies. And a lot of the allergies has to do with the fact that we're neglecting our parasympathetic system, the system that allows us to rest and digest. And so all those things to say that along with the pH testing of the urine to check your body's response to how you're doing with the foods that you're eating or the supplements that you're taking to cause yourself to be alkalinized, we also can check the pH of the saliva, and we give it a lemon challenge. I'll show you how to do that on our next video, but we give your mouth like a lemon juice challenge and see if your saliva responds appropriately with the minerals that it needs to alkalinize and protect your mouth, or if you stay acidic or stay where you're at. And the reason that sometimes people would do that is because they have an emotional stress that's overriding their parasympathetic digestive system. So your digestive system is supposed to be, active and allow you to rest and digest, but if your sympathetic system is in overdrive, or you have a stressor, an acute stressor that's overriding your parasympathetic response, then a lot of times you won't mount the necessary changes in your salivary challenge to see your pH change from the condition it was before you took the lemon juice into your mouth to what it's supposed to do to neutralize that acidic lemon juice. And so if it's not doing that properly, a lot of times you can detect if you're having stress that's overriding your parasympathetic system. Let's see if I have another question here. Just going to check. I can't tell. Are we having any more questions? I haven't noticed if we're having any more questions. But as far as how much vegetarian diet you can eat, you can still, even if you're on a vegetarian diet, you can still have too much acid in your system, because a lot of vegetarians eat a lot of grain or processed food. So this applies to vegetarians as well as meatosauruses, as they say on one of my favorite movies, that with the dinosaurs. That those of us who eat lots of meat and things that are supposed to be bad for us. But here's the Alka-Green tablets. I'll show you guys a picture of them. They just come in the bottle here. They smell like alfalfa grass and cows, but they're just small green tablets with lots of different antioxidants and barley and things like that in them that neutralize the acid in your body and have extra minerals and things that help neutralize the acid. So, okay. One other thing I wanted to bring up, just because of the season that it is, we've been seeing a lot of allergies in the clinic. So if your allergies are acting up, I did want to put in my plug for my fine bee friends at the Owasso beeguide.com, www.owasobeeguide.com, at RJS Bee Farm. I went down there and we got some of his local honey. This is from this season. I was thinking about this today. If you're allergic to the ragweed, it might be a good idea to get, or the pollen count that's up right now, it might be a good idea to check out your local beekeepers. You can, in this area, it'd be the NEOBA, the Northeastern Oklahoma Beekeepers Association. And if you're interested in that, if you've got allergies, if you get some local honey, the way that allergies are treated are, we give you a small dose of of whatever it is that you're allergic to. We check you for allergies, give you a small dose of that in a shot twice a week for a long, long time. You keep coming back and paying us a lot of money for that, and then you can come back once a week and pay us money for that, and then you can come back once every 2 weeks and then once a month for 5 years. Or you can also try getting some local honey. You can also try getting some local honey, and the bees are exposed to the pollen, so if you're allergic to local pollen, things like that, they're going to be exposed to all the pollen that's around. So you might want to get some if you're having allergies right now to stock up for next year, because the bees have been really active with the local pollen that you're allergic to right now. So I'd probably go visit your beekeepers that you can in the area that the bees have been busy gathering the honey right now while your pollen count is high, and get some stored up for next year. So anyway, www.owasobeeguy.com, and if he doesn't have honey for you, then I'm sure he can refer you along to the Northeastern Oklahoma Beekeepers Association, and they can hook you up with someone in the area that does. Or if you're not from here, you can check out the beekeepers in your area, because that's the kind of honey that you'll need to treat your allergies. So, all right. Trying to think if there's anything else. I just wanted to tell you briefly about the pH monitoring of your urine. We have those available here at the clinic. We're selling those for $10. They come with the book, and that's pretty much our cost, because I want to see how my patients do on these following the regimen and see how they feel. So the alkalizing tablets, so you get the whole thing of tablets, and the book that explains to you how to test your pH of your urine and the pH of your saliva, and then also the little pH test strips that you can use. You can come in and get those for $10. In changing your alkalinity of your urine, a lot of times will help you with your diabetes. It's going to help you with a lot of your disease processes that you have. So be sure and come in and talk to me about that, and we'll get you set up with that if you're interested. And then we should be doing another show hopefully in 2 weeks. If you have suggestions or anything you want to hear about, please don't hesitate to let us know, so we can get that on the air for you. If you have any other questions for us, we'll try to answer them either now or at the next, not now, but I'll try to look on the website and see if I can answer them, and then maybe at the next show we'll go over them as well. And so if you're interested in our clinic, please feel free to call us. Our office number is 918-878-7733. We're located at 6530 East 91st Street in Tulsa, Oklahoma, just 91st in Sheridan, right by Bill and Ruth's. And come by and see us. We'd love to see you.